All right, we've been talking about the Senate vote or possible vote on version 2 of the Republican/Trump American Health Care Act. This is the Republican and Trump-led initiative to repeal Obamacare, the Affordable Care Act, and put in place something else. We have been waiting for the Congressional Budget Office, a nonpartisan agency that scores and evaluates government proposals. We've been waiting for their scoring of the Senate version 2 of the American Health Care Act. I'll remind you that House version 2 of the American Health Care Act was scored by the CBO as leading to 23 million additional uninsured individuals. We now have the numbers from Senate version 2 of the American Health Care Act, and it would lead to 22 million people losing insurance. It would also reduce the deficit by $321 billion over 10 years. This is not a lot. I hate to break it to the so-called fiscal conservatives, but $32.1 billion per year is a pretty damn small amount, particularly when it doesn't even consider the costs of the externalities of people not having health insurance. As far as premiums are expected to fall in 2026, nearly 10 years from now, after initially rising. That is an almost worthless part of the prediction. It's very difficult to predict. Think about health insurance premiums, first of all, always go up. It's more a question of how much, not if they will go up. And to predict how much they will go up or drop over a nearly 10-year period is very difficult to predict. And it will be impacted by other forces impacting upon that. We can't really gather much from that.
For Republicans, it was never about insuring the most amount of people possible.
No.
It was about lowering premiums for the average American. So if there's really no evidence that it would even do that, you can see why even folks on the right like Ted Cruz and Mike Lee are not supporting this, because it really doesn't get to the root of the issue.
Well, it's a disastrous bill, right? The root of the issue would be Trump said we're going to have this beautiful plan and it'll be cheaper and more people will be covered and nobody will die, blah, 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 blah. People will die. And earlier on CNN, I watched Kate Baldwin call Congresswoman Jackie Speer hyperbolic for saying that this will definitely lead to people dying. If 22 million fewer people have health insurance, we can't say which of those 22 million people will die due to not having care, but some of those 22 million people will absolutely die from not having care. This bill would also eliminate the mandates which require nearly everyone to have coverage, as well as companies with over 50 employees need to provide at least some health benefits. That's gone. It would eliminate Obamacare's taxes on the wealthy as well as insurers. You need that in order to pay for this entire system that we have, because it's such a horrible system to begin with. But it would maintain much of Obamacare's subsidy structure to help poor people pay for individual coverage, but it will be way less generous, particularly for older employees. As an example, older and lower income enrollees would be hit harder by the Republican plan. The CBO analysis says that a 64-year-old with an income of $56,000 would pay $6,800 for a silver plan under the current law. Already outrageous, by the way. But that same individual could pay up to $20,500 for an identical plan if this Senate bill were to pass. This is an absolute and total disaster. And as an interesting note, according to the CBO, 4 million people would lose employer-provided coverage next year. This whole thing that we hear from the right about, listen, if you get a job, you don't have to worry about it. You're going to have insurance. That's also BS. According to the CBO, 4 of the 22 million people that will lose coverage will have jobs and still won't have insurance.
I think the most cohesive strategy for Democrats to take is that people will die because they don't have access to health insurance under this plan. And the Center for American Progress, which is admittedly a left-wing think tank, they estimate that 17,000 people will die next year if this was to pass. And by 2026, it'll be an estimated 28,000 per year.
I've heard numbers anywhere from 20 up to 60,000 people that we could reasonably expect to die as a result of this. Senate Majority Leader Mitch McConnell wants a vote this week before legislators leave town for the 4th of July holiday. There are 52 Republican senators. You need 50 to vote yes to get this through the Senate. 5 Republicans have already said, we're not going to support this in its current form. Senator Susan Collins of Maine is one of those people. She has a lot of seniors in her state. This may already be dead. And you know what? I've been talking about this for years. You can't start with Obamacare and move to the right and not hurt people. Because after all, Obamacare is pretty damn right wing. It's an idea that was come up with. It was conceived initially by a right-wing think tank in the 1990s. There is no way that you could start with Obamacare and say, we're going to make this more, quote, conservative, really reactionary is what it is, and cover more people for less with better health outcomes. You just can't do it.
Right. I mean, I think the approach is to take away the Medicaid expansion. It's to get rid of a lot of the subsidies. And who's going to be in support of that?
It's absolutely...
the people at the top.
Someone wrote to me saying this is almost Malthusian. If to support this, you have to believe the theories of Malthus, which suggested that the carrying capacity for the Earth's population is it will eventually be exceeded by that population growth, and the only way to adjust for that is every once in a while you need either famine or natural disaster or some way of trimming the population. Only if you believe something like that could you possibly support this, unless you're just clueless like many of these Republicans are. We'll see if we get that vote. We'll see what ultimately happens. Hopefully, it's dead in the water already if indeed 5 Republican senators are not going to vote for it.